Thank you very much for accepting us, Professor Dr. Erman Aytaç. I would like to ask what type of gastrointestinal cancers are today faced more commonly?
So GI cancers incidence is increasing in all the globe, in all countries, because of the development and the Western style living. Especially colon cancers incidence is always increasing compared to the others, and the incidence of the stomach cancer is also increasing because the stomach cancer has different type of presentation based on the geographic location and the lifestyle. But all the gastrointestinal cancers, including esophagus, stomach, large bowel, rectum, are increasing in last decade.
Then it is important to have early diagnosis. How is the early diagnosis chance for them?
Early diagnosis is the key because when you diagnose early, you can just remove the cancer without disseminating, and the success rate is significantly different compared to the metastatic ones. To catch the cancers early, we have screening systems. So far, in GI cancers, we have screening colonoscopy and fecal blood evaluation for colorectal cancers after age of 45. So you can go a gastroenterologist or a general surgeon who is specialized on endoscopy and colonoscopy procedures can do a colonoscopy, which is the gold standard to diagnose colorectal cancer early stage. In Western countries, in our country, we don't have screening for stomach cancers, but in Japan and Korea, they also adopted screening for stomach cancers like colorectal cancers. So there is a need actually for that in our countries too. So when you have the diagnosis early, it's a basic surgical procedure would be enough compared to all the advanced approaches for both stomach and colorectal cancer.
Can we address some specific symptoms for esophagus cancer? For example, having trouble in swallowing can be a symptom for esophagus cancer. And is there a complete treatment for esophagus cancer?
Absolutely. The esophageal cancer starts with difficulty in swallowing, weight loss, some sort of fatigue, anemia. These are the general symptoms actually for all gastrointestinal tract. And for early diagnosis, it's important to do screening. Unfortunately, we don't have screening in our country, in Western countries, even in the United States. Europe doesn't have screening test for upper GI cancers, including esophagus and stomach.
For stomach cancer, what type of stomach ache should be an alarm for the patient?
So it is important to have issues with your routine. So everyone has some sort of aches, some sort of fatigue in various type of their life based on their work life or their own issues during dealing with their regular problems. But if there is like a cramps, vomiting, nausea, increased incidence of ache and fatigue, anemia, vomiting, those are the main alarming symptoms for GI cancers. And also blood in the stool or sputum are the very alarming symptoms that should be evaluated by a professional physician.
After the early stage of diagnosis, which you said that it is very important to have a successful surgery, is there a specific roadmap for stomach cancer?
Of course. In stomach cancers, we usually diagnose it with endoscopy. A pathologist evaluate the type of cancer. Then we do evaluation for clinical stage with CT scan. So in the thoracal area and the abdominal belly area are evaluated with contrasted CT scan to have the idea about the clinical stage, clinical dissemination of the disease to other organs. And based on those information related with biopsy and clinical stage, we plan a treatment. In early stage, direct surgery or endoscopic removal can be just key for the cure. But for advanced stages, we have chemotherapy, immunotherapy, some smart drugs based on the biological characteristics of the tumor that we further evaluate in the biopsy material.
Okay, for colon cancer, any symptoms which are signals of colon
In
cancer?
colon cancer, blood in the stool, distension, dullness, fatigue, change in the bowel habits. So everyone has a bowel habit. Some people can go bowel movement 3 times a day. Some go 3 times a week. Both normal. But if there is a change in your routine behaviors, then you should be alarmed.
And as you have mentioned, being colon cancer age is diminishing due to the different issues in the Western world. So according to the new protocols, what is the new age for men and women for checkup of colon cancer with colonoscopy?
It's a very important, very good question. 45. It was 50. Now we are doing 45 for screening colonoscopy. And if there is a history of colon cancer in your family, this age can be sooner. So if there is a family history, we can also have some syndromes that we start screening age of 18 to prevent further colorectal cancer, like polyposis, like some Lynch syndromes that requires colon screening plus the other organ screening, including breast, bladder cancer, kidney cancer. There are some also familial syndromes that requires earlier screening, but standard screening start with 45.
Thank you. So genetic is getting more and more important in the study and also in the reflection to the diagnosis. Absolutely. Yes. So, is there any complete treatment for colon cancer?
The colon cancer treated with surgery. The key is the surgical treatment, but there is a combined multimodal approaches, including chemotherapy. If there is a rectal involvement, and we consider chemotherapy and radiotherapy before surgery. Especially in rectal cancer, in these days, we also have the chance to cure disease without surgery. So it's an important thing. Around 20-25% of overall rectal cancers can be treated with watch and wait approach. It's a very selective approach that should be performed and monitored in experienced center. So this can be treated with surgery mainly, but chemotherapy, radiotherapy, and also immunotherapy based on the molecular characteristics of the tumor are the main treatment options for colorectal cancer.
I would like to also ask, what are the latest up-to-date techniques in rectum cancer operations?
Rectal cancer operations are improving because of the advanced level of the neoadjuvant treatment options. We apply neoadjuvant treatment for the patient who has no distant metastasis but has locally advanced disease, including lymph node involvement or the intramural part of the tumor is high and it is more. We apply neoadjuvant treatment. This gave us the opportunity to sometimes local excisions in addition to early rectal cancers. There are some selected patients can be treated with local excision after chemoradiation. And we also have a robotic approach for removing rectum by preserving the important nerve for urogenital functions and importantly to preserve anal muscles to maintain intestinal continuity. So the adoption of robotic techniques is getting higher and higher every day in the management of rectal cancer.
And I know that here you have an excellent center for robotic surgery. Absolutely. And even you are a training center as far as I know.
Absolutely.
So is it possible to move to a normal life after rectum cancer operation?
It is possible, but it requires a multidisciplinary approach. In addition to the treatment, caregivers for oncologists, radiation oncologists and surgeons, we also have pelvic floor specialists to adapt new rectum, which is created from the large bowel by anastomosing and putting together to the anus, new rectum for new life. So pelvic physiotherapists, special physical treatment professionals, doctors and gastroenterologists is a team approach to get the similar quality of life in patients who had low anterior resection.
Very important. And after each rectum cancer operation, patient sure will have a stoma?
Not 100%. Stoma is something that we give a time for neoanastomotic site at the rectum to heal. So the patients who had chemoradiation and the patients who had very low-lying, very The anastomosis deaflin is so close to anus aperture that requires ileostomy, but it is not mandatory. So we use it selectively.
Yes, again, I would like to underline regarding the robotic surgery. Is robotic surgery really making a difference for patient? And how is it appearing to the patient routine life after the operation or the recovery stage?
In the setting of rectal cancer, the role of robotic surgery is increasing every day. The papers also now showing us the benefits of robotic surgery on oncologic outcomes for local recurrence, which means the development of cancer after removal usually occurs in first 1 or 2nd year, decreasing when the patient has robotic surgery in professional hands. So it is an important finding. Every year, the adoption of robotic technology for the treatment of rectal cancer increasing not only life quality, it's also increasing the life expectancy and the recurrence rate decrease after robotic surgery. So increasing the life expectancy and decreasing the local recurrence.
Which are very, very valuable facts for patients and the families. How is the follow-up after operation for international patients in your center? Considering that the patient came here and has been operated for any type of GI cancer that we have discussed, how is the follow-up after the operation for a patient?
We usually admit the patients almost 3 to 7 days after operation. So ask the patients to stay 3 to 5 days after discharge from the hospital. After this, the patient usually comes in next 3 months for having the follow-up for screening after surgery. If the patients have adjuvant treatment, some of the patients requires to have the continuity of the chemotherapy here in our clinic, or we can plan the treatment and they can continue their chemotherapeutic or other oncologic treatments in their homeland. So based on the patient preference, we can plan both ways based on the technical efficiency and the adequacy in their homeland and our center.
And I know very well that you have treated several patients from Romania.
Absolutely.
Just as a curiosity, if you have a specific memory or anything would you like to share with your patients for Romania?
And then also very well-known colleagues from Romania. Romania become for me like my own homeland.
Yes.
So we treated tens of patients, maybe 100 patients from Romania so far, and they have from minor to major operations had their for treatment course. So thankfully, a majority of them had a very good post-operative course, and we are still following up. And there are some patients who had no operation, very successfully chemoradiation gave them the chance of having rectal cancer treatment without operation. And we have a couple of patients underwent very extensive multivisceral dissections and had their life saved and still coming for the control checks.
Very nice to hear that. And what would you like to state to international patients during their decision to choose Turkey and specifically your center in Memorial for GI gastrointestinal cancers?
Absolutely. So Turkey has a very high level of technology in many other centers, but the specific centers are few. Our difference compared to the other centers, in addition to advanced technology, because you can have the advanced technology by having the support of the company, but it's important to have the trained personnel, including doctors, nurses, and other caregivers to adapt this technology, and it's important to have the treatment in a multidisciplinary center, specifically focusing on certain diseases like colorectal cancer, inflammatory bowel cancer, or pancreas cancer, but it's important that we have a specific center focusing on treatment of single system for gastrointestinal cancer. So our oncologists our surgeons, our radiation oncologists, our radiologists also are very specifically focusing on to treat only one system disease. So this makes our difference compared to the other centers, and not only focusing on the disease treatment, we also have a specific pelvic floor team who is focusing on their quality of life after treatment, which is very important and expected factor. And people after treatment, they are looking forward to go back their regular life. So we also have a specific team focusing on this, and there is a few centers having all this opportunity in single doom on the world, not only in Turkey.
Okay, thank you very much for
You're
yourself
welcome.
and your dedicated team to be able to assist all the patients. Thank you very much, Doctor,
Thank you very
for
much
your
for having
time.
me the opportunity. Great pleasure.